Hello everyone, this is Dr. Ajithkumar, Assistant Chief Physician, Apollo AyurVAID, Chennai. We get a lot of cases called osteoarthritis. You also must be very familiar with it, this particular terminology called osteoarthritis. What exactly the term osteoarthritis means? Osteo represents a bone. Arthritis represents inflammation to an articular joint. These two terminologies together is known as osteoarthritis, the name of the disease. So before understanding what is the management of osteoarthritis, you should know how a normal articular joint is structured and functions. See, every articular joint has got two pieces of bones which is connected with different kind of ligaments, and there is a capsule which is covering the entire joint, what is called an articular capsule, joint capsule, which has got a secretory epithelium, and the bony ends are covered with cartilages, which is acting as a buffer washer while the joint is being rubbed each other, moving each other. The secretory epithelium secretes a greasy kind of lubricant material that ensures the lubrication in the joint while you are using, so that the articular cartilage does not easily go burn out by the friction of the movement of the joint. And the friction will be more when the joint is a load taking, weight bearing joint like knee or a hip kind of joint. So, because of any kind of a hit or any fall or any trauma or any injury, or because of a disease like any viral infection that can cause viral arthralgia, for example chikungunya kind of disease, or it can be an autoimmune condition called rheumatoid arthritis or other these kind of diseases that can cause an inflammation to the secretory synovial epithelium, and this epithelium getting inflamed stops secretion of the natural lubrication, and the swelling takes over the joint. Maybe if it is not properly managed, by the time the swelling withdraws, the lining of the secretory epithelium becomes sclerosed or dead tissue layered, so that it no more secretes the necessary greasing effect required for the lubrication of the joint. So the articular joint, as it uses, you use it more and more, the cartilage tends to rub to each other and it gets eroded off because there is lack of lubrication very easily. This induces pain, this induces deformity, deshapement of the joint, and probably sometimes it becomes on a long run unable to use because the bone to bone it starts rubbing, the pain becomes extreme, and sometimes even a calcification happens between the joint by osteophyte deposit. Because of the process, the body is trying to protect the joint or strengthen the bone by pumping in more calcium. Ayurveda has got very effective treatment for this condition called osteoarthritis, and provided you meet a physician and start the treatment at the earliest possible, not if it is not too delayed, probably we can save the joint without much of the damage, and mostly we can even bring it back the natural lubrication and the normal joint health back, so that joint will not get damaged by the use. What you are going to use for the treatment protocol depends upon the root cause of the osteoarthritis condition. If it is triggered by a viral arthralgia, then one set of antiviral medicines to neutralize the viral toxemia has to be induced. Certain kind of fomentation and upanaham or a kind of a paste application around the joint and bandage and keeping it for some time so that the inflammation is getting relieved of. These kind of treatments, or treatments like Elakiri or Manjalkiri, will have to be used according to the condition for the flexibility of the joint and pain management. And finally, maybe a relubrication of the joint by a process called Janivasti, Kadivasti, those kind of oilation and massage kind of process accordingly, or even a joint strengthening final thing called Mamsanavara or something may be used. This is as per the condition the doctor will inspect and decide you. But see that if you are not handling this on the right time, the joint will not be coming back to its complete proper health, and the 100% recovery might be at risk, and it can end up with a joint replacement surgery, which will be pretty costly, as well as usually, as you know, like a natural body part, an artificial fixer does not repair by itself. So on a long run, it might not be a stable solution. So whoever known to you in your family or in your friend circle who is suffering from osteoarthritis, please direct them to a good Ayurvedic physician and take necessary Ayurvedic treatments so that the joint can be revived back to its original health if it is not too late. And if it is too late, probably we can help them to recover the joint health and mobility to the maximum possible level with a good pain management mechanism.